Well, now that our viewers have had a chance to see each of you work with Chi-Chi, what we've done is Gary and I have picked some clips from the sessions and would like to have each of you get an opportunity to talk amongst yourselves about the clips and each other's work. So why don't we begin with a segment that we've taken from Dr. Greenberg's session.
And as the tears come up, can we stay with them, right?
Okay.
I mean, what actually happens inside when you feel all this tearfulness? If you were to go to your body,
I feel like it's never going to change, and I'm always going to be this person that does nothing but talk about all these great things.
it's a kind of sense of hopelessness.
Yes.
Then I think you're
Yes.
saying, right? I just feel like nothing will ever change.
Right.
And then you sort of move away from that, either by getting angry at yourself
Yeah.
or, and as you say, talk about it, but it doesn't help. But
Yeah.
can we try to stay with the hopeless feeling, your hopeless feeling, right? Where do you feel it in your body if you can? Like, what's it feel like even now as you...
It's like almost like a tightness, like through my chest, and I would say all the way down to my stomach, almost like a sick feeling.
Right, so it's all here.
Yeah, it's all
right,
here.
Right. So if you could try and pay attention to that almost, and it may even help to close your eyes and try and describe that first.
It's like a sinking feeling.
Yeah.
It's like you're on like when you're on the top of a hill or a roller coaster and you're going down, that sinking feeling.
Yeah. Okay.
Except it's not exhilarating like a roller coaster is. But that just, like I'm drowning, like I'm sinking.
Yeah, stay with that if you can. Can you maybe even talk from that? I'm drowning, I'm sinking. I mean, this is the difficult feeling.
Yeah, I think that's the closest thing I can describe it to, that I'm drowning, that I can see a light, but I can't reach it, and I know that I will never reach it.
But it's like I can see a light, but somehow I feel like I can never reach it.
Right.
Yeah.
But it's up there. It's
out of reach.
Yeah, I can't get to it.
Yeah. And if you just stay with that feeling, right? It's like I can never get to it. Just let words come from that feeling, or let it go wherever it goes, and just follow the feeling that I can't quite get it.
Les, can you tell us a little bit about what you're trying to do here?
Well, I think this is really working with emotion, and the idea is to approach the emotion, attend to it, symbolize it in awareness, and people tend to avoid being in the present with their own experience. So I'm trying to get her to stay with that experience and to really attend to it so that she experiences it in a present sensory manner and then make sense of it by putting it into words. And I sort of believe you have to arrive at a place before you can leave it. So she's moving to a painful sense of hopelessness, but I believe there's more there, and it'll unfold and move forward, because essentially I'm working with symbolizing an awareness, bodily felt experience. And that's what I would see myself as doing.
Mm-hmm. Any other comments that you might have about this, or questions for Les?
Well, this is one of the places where I felt I would work very similarly to you. You're focusing her in on the body. I would probably be thinking in my own mind that she seems to talk about feeling, and tears come out of her eyes, but in some ways she's not fully connected with her feeling. It's very subtle thing. And I would have probably been doing something very similar there. And I noticed that as you pursued it, she went to metaphor, looking for a light, feeling like drowning. And I know there's a lot of research that correlates with people improving in therapy. So that would be an overlap between
And
our
that
approaches.
metaphor seemed to be exactly what her stated problem was, of not being able to finish, not being able to follow through.
Yes.
Yeah.
And I would have done something very differently from my orientation. I didn't see Chi-Chi as having a lot of pathology. I had her fill out certain scales. She doesn't have a diagnosis of depression. She doesn't have a diagnosis of anxiety. She does have a big problem with procrastination, though. And so what I would try to do is to solve the problem as directly as I could, and then see if certain ideas or emotions get in the way of doing that. And so I structured the session to have her make a plan of how she could overcome the procrastination, what thoughts would get in the way, how she would address those thoughts. And if that didn't work, then I might have to go deeper and see what kind of ideas she has about herself underneath that we might need to address. But I would stick to a more superficial level at first and see if that solved the problem.
From my perspective, what you're describing there would be analyzing the resistance. If it turns out there's a resistance within her to doing what you and she collaboratively decided she was going to do,
That's right.
then you would move to the deeper.
And I would also move to focusing on emotion if I were dealing with a client who I knew was really avoiding emotion, who was even having trouble identifying what she was thinking, what she was believing, because she was trying to push away the emotion so much. So that's a particular instance where I really would have people focus on their bodies, on their emotions.
But I think the fact that the emotion is emerging and that the tears are there, they send a very strong message that this is an issue of major concern to me. Yes. So that it's really important to go into them and also validate them.
Now, in the intake interview, when I met with her, she said that she responded well in therapy where there was more structure, where she was given direction, and she tended to become overwhelmed if too much emotion was evoked. Any comments on that?
Well, I have kind of a way of thinking about that problem. I think that she does need to go into that affect and detoxify it rather than avoid it. I would agree with Judy that I didn't see her as having a lot of pathology, but I think she has a subtle kind of problem inhering in her personality. So it's a funny combination of both. She's not that sick, but at the same time, there's this pattern that has characterized her whole life again and again and again and again. And I wouldn't limit it to procrastination because a variant played out in her most intimate relationship when she sabotaged a potential love affair.
And I saw her as having a lot of distress, and I wouldn't call it pathology, and I don't tend to use a sort of framework of pathology, but I think she had a lot of distress and that she was suffering and that she has had significant personality and interpersonal problems in the past, which she struggles with. She copes, but there's a lot there, I think.
And I think I probably put more of the emphasis on the positive. So when I spoke to her, I talked to her about all of the things in her life that she doesn't procrastinate on, and all of the wonderful strengths that she has, and how maybe what she needs, and I don't know that this is accurate, but maybe what she needs is more of a structure in order to reach these goals of things that she's been putting off.
Well, this was just the kind of discussion I was hoping for.
Yeah, absolutely.
We should move on. And did you have a comment?
The various points, she used a lot of strong words from time to time. How do you pick among which strong words that really imply feeling and affect behind it?
Well, I just go for where the affect is. So where the affect is the strongest, those are probably the ideas that are going to be the most important to go after.
What were you thinking, Les?
I mean, I'm not quite sure when you say strong words, we'd have to look at it specifically, but Yeah, I mean, I would think facial expression, vocal intonation, and general poignancy, I mean, are the indicators. And then I would focus, because I see them, and particularly we have a measure of what's called focused voice quality. And it's when a person has this kind of eyeballs turned inwards and the voice is in a particular manner with pauses, that's a time to go in.
I think I do it somewhat more intuitively, but with this, on the same principle that I try to feel where the affect is the strongest. And I think a lot of that goes right brain to right brain, and it's not too easy to describe. But yeah, facial affect would be the main.
Right. And I think one of the biggest things is my own gut response.
Yeah.
And what I'm feeling is an important barometer or compass for what my responses are.
Why don't we move on to our next clip, and we'll get a chance to see Dr. McWilliams work with Chi-Chi.
Well, let me change the topic a little bit and go to where I felt that you had the most emotion when I watched the original tape of you with John Carlson. And that was around the loss of that relationship. Are you willing to talk about that and what that meant to you? I think that's connected with this instability.
For some reason, it's really hard for me to talk about that one. I can talk about all the rest. I can talk about the one I'm in now. I can talk about all the ones in the past, all my past disasters. But that one, I think the reason that one is so hard for me to talk about is because I really do think that was one where where I really did.
Were you sabotaged it?
Yes, where I really just completely ruined it. And I don't think people should. I don't think it's healthy or good to constantly have a regret about something like that. I think you have to be able to move on. And I think I have. It's just that it's...
Well, what comes through is not just regret, but shame. That you, at least that's what I'm feeling from you, that you acted in a way that you feel mortified by, in retrospect.
I do. I feel mortified by it because I feel like it was completely in my hands, and it was completely within my grasp to have made that work. And for some reason, I didn't, and I deliberately destroyed it. And
are you willing to tell me what you did? I think one of the ways to combat shame is to actually say what's so shameful and see if there's another way to think about it. If it's too much, you don't have to go there.
No, it wasn't something I did that I'm ashamed of so much as, well, I guess part of it is, I allowed, I feel like I allowed too many outside influences to make a decision for me that was not in my best interest. And I guess what I feel ashamed about is that I did that, is that I was a grown person and I didn't act on my own, in my own best interest. And that's what, when I look back, that's my regret.
Nancy, can you talk about this clip and what you were doing?
Well, first of all, I was feeling a tension. This was one of the times where I felt the fact that she was on camera and a lot of people would watch this put me in almost an ethical bind. I wanted her to go more deeply into feelings that were extremely painful to her, and I felt like she wasn't quite ready to do that, and I wanted to give her space to not have to do that. But if you'll remember what she said, she started to move into talking about what happened. Then she moved into self-talk that she should just move on. You could almost hear the mother inside her saying, you know, stop fretting about this. You shouldn't feel this way. And I wanted to bring her back. She was being kind of vague about what happened. Ordinarily, I would pursue the particular, as Edgar Levinson used to say, and ask her to tell me the details of what happened. I didn't quite want to do that on camera, but I wanted to see if I was right that there was shame under there. That's what I found myself attuning to. So again, it's intuitive.
How did you happen to decide to jump right into this failed relationship that even evoked emotion during the intake interview?
Well, I had seen the intake interview, and I had seen that that's where her affect was. And it just seemed to me that her tears were more connected up with her inner experience when she talked about that than when she talked about other problems.
Other comments you guys might have?
I agree with Nancy. I would have exactly wanted to go back with her and get more details about what happened. In fact, I don't know if we'll show this clip, but I also asked her when I was interviewing her if we could talk about that relationship, because it was the only time that she showed strong affect during the evaluation, and she didn't want to.
Oh, interesting.
So what we did instead was to look at what fears she had about talking about it.
Yeah, it's an interesting problem where you want to talk at least in a meta way about what's hard to talk about if the person isn't ready to talk there
But it's
yet.
so important to be collaborative with the patient, and I
Yeah.
think that that's what you were doing. You were being so respectful of her and collaborative with
Well,
her.
thank you. I noticed that in your tapes too, and in Les's.
So this brings up the complexity of these tapes themselves, in that I found it difficult having the intake interview because it gave me information, but I really like it to come up from the client in the moment in our relationship. So clearly in the intake interview, this had been the most poignant issue, but the way I work is I wouldn't bring up and allude to things in the past that hasn't occurred in the relationship and here and now. So I wait for markers to come up. So I was interested to see how you did refer back, to the intake interview, although I did that a little bit. But she does seem here clearly it's a very important thing, part of it, and she has a lot of unfinished business and unresolved bad feelings, and then she blames herself, which is what you were commenting on. But this tension of how much can you bring out on the film versus how much is she anxious about revealing is a tension, right?
Yeah.
And how common would that be? At one point you say, you can talk about it, but I don't want you to talk about it if it's too fast.
I would
How
tend to say
common
that.
is that in your work?
Well, especially toward the beginning, I would say that very explicitly. And I probably think about this in a different language from Judy, but I would do something rather similar later on when a person says, there's something I just can't talk about. I would probably say, well, let's talk about the feelings you're afraid of feeling if you were to talk about it, rather than saying, spit it out, try to talk about it. But I think later in treatment, there does come a point sometimes where I would say, be brave, see if you can just say it. And again, that would be a matter of attuning to what they could tolerate.
I don't find it comes up all of that often. It does come up, and especially when people do feel a sense of shame and they don't want to say something, or they're feeling particularly vulnerable in the chair with, in your office with you, and so that they might not want to reveal. But usually, I think you can pick up from their nonverbal affect, and as Les was talking about before, their tone of voice, their body language, their choice of words, their facial expressions and so forth, that there is something there. And so when I see a change of affect, makes me think there's something there, I'll stop and say, how are you feeling right now, and what was just going through your mind? And that's where once in a while they'll say, well, I don't really feel comfortable talking about that now. And then I see collaboratively if they're willing to talk about what ideas are getting in the way of their being willing to talk about it.
Now, is labeling a feeling for the client like shame? Is that something that you all do?
I would tend to draw it from the patient, so the patient says, okay, so here was the situation, and I would say, and how did you feel? And if the patient has difficulty labeling it, I'll just give a multiple choice. Were you feeling happy, sad, worried, angry, and so forth. And the reason that I want to have a label to the emotion is because I want to hear the whole story. And it may be that the patient had a mix of emotions, and there are different thoughts that might be connected with each one of the emotions. So in order to get out the whole story, I want to really find out what the whole emotional experience was.
I think I talk about empathic conjecturing, and it's very important that it's a guess or that it's done very tentatively, and that the meta-alliance, the client is very clear that it's always in the spirit of, I'm checking and asking you to check, does this fit? So there's always that tentativeness is important, and not to receive it as, this is what you're feeling. Right? But I do think that it's helpful. You can go like half a step ahead, but not 1.5 steps ahead of people. But I think it is helpful to do some offering of words to people, because it helps them recall and check, is that what I'm really feeling? So it's a kind of back and forth process where you offer them a word and they check it, and that helps carry people forward.
So that seems to be a commonality across all three of your approaches: presenting something in a tentative light, giving the patient an opportunity to take hold if it's useful to them, but to be able to say, no, that's not quite right if it's not.
It's probably a matter of balance among the three of us, so I would tend much more to try to draw it from the patient herself.
Yeah, I'm not sure I would be that different that way. I just had a strong feeling and I wanted to pursue it this time. But yeah, the tentativeness, I mean, when a client can tell you you're dead wrong and then correct you, I think it's a therapeutic experience for them.
Let's move on to our next clip, and we're going to get a chance to see Dr. Beck now work with Chi-Chi.
So we can either talk about something that you have tried to bring up in the past, or we could talk about something that you could imagine you will want to bring up in the future.
Right.
Which do you think would be more helpful?
Let me think for a minute. I guess we could talk about something that's ongoing, I guess.
Oh, that's even better.
Yeah.
So tell me about that.
Well, occasionally Mike will talk about our future together, and he'll say that he wants us to get married or live together or any of those things. And then we'll talk about it, and it seems to be a good conversation. But then the next time that I bring it up or want to say something about it, it's like we never had that previous conversation. It's gone. And so it seems it's almost like he's responding to some sentimental feeling or some romantic feeling, and he talks about this stuff, but then when I want to talk about it and want to really pin him down, it's like it never happened.
What does he say?
He just says, well, yeah, we'll talk about that later. And so that's one thing. I also feel like I haven't really conveyed to him what some of my concerns are with. I feel like he'll talk about things that he wants to see happen and is completely ignoring what I'm saying. One of the big issues that we had in the past, I think it's not going to be an issue now just because of biology, is he would sometimes say that he wanted to have children, and he wanted us to have children. And I would and he would, have he's a very methodical, logical person, and he would sit there with this very long, methodical list and go through it, and I would be responding very emotionally, trying to
Right.
get him to see my point of view,
Right.
and I would feel like he just did not hear a word I was saying.
Yeah.
That he would just keep on with his list and just talking right over me while I was just screaming at him. And so I still feel like that these issues are unresolved, and I still sometimes wonder, like, does he still think that we're going to have a child? And if so, why does he think that? And and every once in a while he'll say something that indicates that he does, and I go, but again, when I try to pin him down, he just skitters away. So it feels like there's these kind of big, important issues out there
Yeah.
that couples need to figure out
Yeah.
that we haven't. And so I think that's, that's frustrating. And
Now, can you wait till the next time you see him in person to have a conversation with him
Yeah.
about these things?
yes, yeah,
And you think that would be better than on the phone?
I think so. I think so.
You know, the phone is awful hard because you
It is.
you can't get the nonverbal feedback.
No, you really can't.
That
You really
way.
can't.
Yeah.
And yeah, it's.
Yeah.
And we do the video conferencing, but that's not
It's
the
not
same
exactly
either.
the same,
It's not
yeah.
quite the same.
And when do you see him again?
In 2 weeks.
Oh, he's coming very soon.
Yeah.
Oh, okay. So
Yeah.
this may be apropos to that topic.
Yeah.
Judy, could you tell us a little bit about this clip? What were you thinking? What were you trying to do here?
Sure. Well, as in every session, at the beginning of sessions, I ask patients, what problem or problems do you want my help in solving today? And so Chi-Chi brought up the problem that she has of getting too emotional in certain interpersonal interactions. So at the beginning of this, I was just giving her a choice of what specific interaction did she want to talk about, something in the past, something in the future, and then she came up with a wonderful one that's so important to her, which is the problem of talking to her boyfriend about whether or not they're going to have kids. And her automatic thought was, if I try to talk to him about this, I'll get too emotional. And from what she described, it sounds like, yes, that automatic thought was probably true. She would get too emotional. She had in the past. So it didn't look like her thinking was distorted, especially because she's not depressed. She doesn't have an anxiety disorder and so forth. Her thinking was, I thought, pretty accurate. And so when thinking is accurate, one of the things that we do is just go straight to problem solving. And so that's why I spent a little bit of this clip, and you see later in the session as well, talking to her about how she can talk to her boyfriend about this difficult topic. We did a little bit of role playing, things like that. So it wasn't typical cognitive therapy in that I wasn't addressing distortions. It was typical in the fact that I was doing some problem solving.
Any reaction you might have to the clip?
In general, and to this clip, I mean, I see it as very problem-solving oriented, and I would personally try to go to the underlying determinants. And I see the surface problems as manifestations, but that there's really a lot going on in her life. Now, one of the interesting things was she actually seemed to improve over the series of sessions. So she seemed a lot more integrated in your sessions, and there she did seem integrated.
You guys should do this more often.
But I think the fact that she gets so emotional is part of that. Affect regulation is one of her difficulties. And the way that I think about it is you've got to go to the underlying shame, the underlying fear of abandonment in order to help her rather than problem solving. So I think there's a type of difference between a coping focus and an underlying transformational focus. So they're working at different levels.
I was watching this for the first time and trying to think what I would have done. And I think I would have, I often do engage with patients on problem-solving issues. I might even role play now and then. But I think with this, my read on Chi-Chi is, at least at this time in her life, she is a deeply emotionally triggerable person. And I might have worked with her to try to accept that in herself more than to try to change how she could talk about something with her lover. I think I might have worked with, well, what would be so terrible if you do cry while you're talking about this? Could you just say to him, listen, I don't think I can talk about this without crying, so, bear with me. Because I think there's a part of psychotherapy that we don't talk about very much, especially in these days when the insurance companies want sort of target behaviors. But it has to do with acceptance of things that might not be so changeable so fast. A lot of what people have to do is accept who they are.
Yeah. You didn't have the luxury of seeing the whole session, unfortunately, but, and I would agree with you completely about some other patients. I didn't get the impression from her that she saw her sensitivity and her emotionality as meaning anything more than it gets in my way of doing what I need to get done. But it would be a very interesting experiment if we had 3 Chi-Chis and we all saw them for a certain number of sessions, just to see what would be more helpful and less helpful.
But if I can just comment on that, I mean, I see her seeing her distress emotions, which I would say are secondary phenomena, getting in the way. But she doesn't ever deal with her primary emotion, which essentially is shame, which is what you were picking up, and also fear of abandonment. And then she has symptomatic emotions, and she feels angry, frustrated, and she gets upset. But the issue is that, and then she reacts and kicks herself for having those emotions. But the issue I would see is how to get to the emotions that she's actually not addressing, and that kind of avoidance of what she isn't addressing.
And and again, we need to do an experiment, because it may be that what you're saying is 100% accurate, and that really, if I were to work on a more superficial level, it just wouldn't work with her. On the other hand, it may be that she's a pretty well integrated person who's accomplished a lot in her life, but still has some specific goals that she wants to meet, and that we might be able to do this in a much more straightforward way. The advantage of assuming that there's a more straightforward way is that you can get very quick symptomatic relief. Here's, all of our patients come in to see us because they're suffering. If we spend a lot of time in transformational psychotherapy, which I think is very helpful for some people, then we don't teach them the coping skills they need, or that they could benefit from, to start feeling better right away.
Well, I probably disagree with you on that. Not about the importance of coping skills and such, and I do sometimes work with people on that, but I don't see the evidence that symptomatic relief is faster with looking at problem-solving behavior than it is with standard kinds of emotionally oriented psychotherapy. I don't think we have the data on that. There's an assumption that it is, that people stay in therapy for years, so we must be able to do it faster. But in my experience, people stay in therapy for years because they're getting something from it, and they started getting something from it very early.
But I do think the research shows that there are certain evidence-based practices and approaches where patients have maybe 8, 10, 12, 20 sessions, and the Axis 1 disorder they came in for is resolved by the end of that time.
Yeah, that's true.
I think things are a little different, though, when we're talking about Axis 2 patients.
Now, I noticed that when you began this clip, you asked her if she wanted to work in the past or kind of in the future. Is your perspective important in terms of whether you work past, present, or future?
Well, I almost always start in the present. What problems are you having today that you need some help in solving? How can we help you feel better by the end of this session? How can we help you go home and have a better week? And so I would stay in the present until we got stuck. And this usually only happens with Axis 2 patients. And then we might need to go into the past to see how certain beliefs about themselves and others in the world originated and how they got maintained, but also then what happens today. And we're always future-oriented. What are your goals for treatment? How would you like to be different?
Is that similar with your approaches?
Well, I would say I'm working in the present, but I'm bringing the past into the present a lot. But I mean, you're always working in the present.
Yeah.
So the distinction sort of breaks down a little bit, I think, so that I am saying even the future exists in the present, so that It's your present experience that's important. I mean, I make this distinction much more between conceptual experience and bodily felt experience. And I think you can work conceptually in the past and in the future, but when you work experientially, it's happening always in the present.
Yeah, I would agree with that. I mean, I stay in the present too, but I often ask the patient, how do you understand this problem? What's your understanding of it? And that always takes it to the past. Or when I'm working on their sense that they're in a conflict and they're resisting some change they know they should have, I say, what's going on? It goes to, well, my parents told me this or that. So the past comes in, and certainly we look toward the future. What would you like to see different? But I think I similarly stay in the present.
Now, you've each had a chance to watch one clip from the other's work. Any thoughts or feelings that you're having right now?
Well, I think there is a real difference between a coping and problem-solving approach and our two approaches, which are more depth-oriented. And then I think the difference is that I use more active techniques, maybe,
Yes.
than does Nancy.
Yes.
But the sort of focus is very similar. And then
Okay, so maybe our viewers will see that in the next clips. Yeah. Any other
Yeah.
thoughts?
It's interesting. It does sharpen up the difference, but behind that I also see some, there's a therapeutic presence that comes through with all of us.
With all three.
But it's interesting that I think we do start from different assumptions.
Yeah.
So my assumption, for example, is what do we do to get this patient feeling better as soon as possible? What can we do today to get her feeling differently? And I think that obviously it's a slightly different focus if you're doing more in-depth therapy, which is something I
be
would do with
encouraging them to grieve more and assuming they'll be feeling better that way, rather than to help them change how they're behaving so that they get a better outcome.
Now we're going to go through some more clips, and we'll do it in the same order. So why don't we start with the next clip of Les's?
Tell her how she's not that good anyway, or why it won't succeed. Because there's sort of two parts. One is you'll not get it done, but the other is you're not good enough. So what do you say to her?
You're just going to be exposed for the fake that you are.
Yeah.
You're not. You're going to give it a half-assed effort like you always do. Give it up.
So you'll never, if you try, you'll fail.
You'll fail.
Right. So don't even
bother.
Don't even bother. Don't get to it. Yeah. Does that?
That's that's
What you do.
yeah.
Change, if you will.
Okay.
What's it like when you get that? I mean, already the tears have come, but what's it like when you get that message?
You're right.
Yeah, yeah. But what's it feel like inside? Yeah, breathe. And really go to you, because what does it actually do to you?
It makes me feel small.
Yeah.
Small and helpless.
Yeah, yeah, yeah. And this is the painful feeling.
Right.
Let's try and stay with that, right? So tell her I feel small.
That makes me feel terrible.
Yeah.
It's
And then
not true. It's not true, and I don't know why you're saying it. But we both know that that's not true. And maybe you're right to a certain extent, but I don't know. I don't have anything to say to it. I don't.
And what do you feel as you sit here?
You're right. I mean,
It sort of feels hopeless, or
Yeah.
you feel
yeah,
like giving up.
yeah.
Tell her what it does to you. It makes me feel.
Well, now I feel like I have no reason to make any effort.
I feel like, what's the use?
What's the use?
Yeah.
What's the use?
And then I just kind of retreat
Yeah.
almost, or kind of.
I don't want to have this conversation anymore, so we'll just drop it. I don't want to hear it anymore, so we'll drop it, and I just go away.
Talk about the
would
going
just-
away. What does going away mean? I just.
In my mind, I just walk away. I just go away from it, distract myself
Yeah.
from it.
Yeah. Yeah.
Les, can you comment on this clip? I'm especially interested in how you use that empty chair technique to kind of externalize this internal dialogue.
Right, and there's a lot going on technically here, because firstly it's like getting the right negative automatic thought, or which is you'll be so exposed. And it begins to get at the subtlety or differentiation of some of her internal process. And then when she goes to the other chair, in some way she says, you're right. And the goal in this dialogue is eventually to get another voice, not a voice of agreement, because this is to try to get the affective experience. And so the chair dialogue has nothing to do with, is it true, is it correct, or whatever. And this is where I think it differs from a cognitive approach. It's actually to get at the underlying feeling. And it may seem paradoxical, because I'm taking her into the feeling of it's hopeless. And, but yet it's based on this approach that really the only way out is through, and that you have to feel something in order to heal it, and that you have to go into it. And she gives us such a beautiful example of how it's a dreaded feeling, and she just withdraws and pulls away from it. And that's what's happening in her automatic processing in real life. And this is where we're trying to get a change, because as she begins to be able to approach it in the session with the support of a secure therapy relationship, she'll slowly begin changing her automatic processes. It's got nothing to do with deliberate reasoning or even with cognitive understanding or intellectual insight. It's got to do with actually changing her behavior in the session, where she can approach what she previously avoided and find that she survives it, because it is so dreaded. And when she says, I just go away, it's so poignant, and it's in her voice. I mean, it's really catching the struggle and the pain that she experiences. And when I said before she was maybe not so integrated, I mean, we're all not integrated, but there's a lot of pain. There's a lot of pain. And I think that pain needs to be addressed.
You know, and it's interesting because if she had had an avoidant personality disorder, I probably would have done something more similar to what you did. And because she probably would have been not only avoiding moving ahead in certain areas of her life, but she would have been avoiding even thinking about moving in those areas. She would have been avoiding negative emotion. I didn't see her as someone, though, who avoided negative emotion. I feel that she really allows herself to experience it, and that's why I would have just worked at a different level.
I did feel that she avoided the depth of the shame, and I thought that the sense of being exposed was part of that. I have to say I loved watching this, because I've never watched the empty chair technique, especially as done by a master. I've heard it described. I tried to do it once as the patient. I didn't like it. And I remember back when Pearls was talking about it in the late 60s, early 70s, I thought, that's just too gimmicky. I would never go there. I couldn't integrate that with my sense of myself as a therapist. But I was fascinated to watch it done by an expert and to see what came out when you did it. And I think what came out would be what I would be looking for through more traditional means, but I'm struck by watching a master at it.
Now, in this segment, Les, there's some ways in which what you're doing is much more coaching-like, a little bit like what Judy does. Can you say something about that part of it?
Yeah, I mean, I do talk about emotion coaching, which is a combination of following and leading, but it's, I would see it as, not kick in the pants coaching. I mean, it's very subtle because I'm really saying attend to this, attend to that. And it's like what I said before, you can be one step ahead or half a step ahead, but not 1.5 steps ahead. So I think there is some guiding. I think that's the best term to use. And there is a coaching element to it. And the coaching is always to try to help you take the next step in this moment. So it's very attuned to the moment. It's not goal-directed. It's marker-guided. And the goal is to get you to experience more deeply. I mean, that's what I'm coaching towards.
Now, I'm sure some of our viewers are watching the three of you work, and they're noticing that Judy takes notes, that she's got her pencil and paper out and is writing, and the two of you don't. You're just use more your present without taking notes. Can you talk about that? Whoever, I mean, I don't.
I actually do sometimes take notes in sessions, often until I sort of feel my way into the affect. But I don't do the kind of writing down and sharing it with the patient that you would do. I keep it for my own records.
And I always take notes unless the patient is getting really emotional, or unless I feel as if taking the notes is interfering with the immediacy of our relationship. But I am taking notes, and I'm taking notes for the patient too. So I send the patient home with notes at the end of every single session, because there are things that the patient learns in every session that I want her or him to practice at home. Different ways of thinking, different things to do. And I find that taking the notes also can help slow down the session a little bit, because and I thought we were all pretty good at the following, which is using the patient's own words then to spur them to go a little bit deeper or a little bit further. And so when the patient says something that I think is very important, then I'll write it down and repeat that.
I know your answer, because whenever I see you, you want to borrow a pen.
Right, so I would see two main things. I give primacy to the relationship, even above emotion, so that I feel face-to-face communication is crucial. And Levinas, this French philosopher, talks about the demand in the face of the other. The face of the other demands a response from us. So writing would be totally distracting for me. And I think there's a lot of right hemisphere to right hemisphere communication going on. People are reading your face. And the style of relating is very different. I mean, it structures a different relationship. That's what I'm really saying. The second part is I am not aiming for information. So anything written down on a piece of paper isn't an experience. Now, I do think it's important to symbolize something conceptually at the end. And I think in that way, it's helpful. But the goal is the next moment of experience, so that the information on the piece of paper isn't really what I'm aiming for, because that's not that kind of change that I'm aiming for.
Well, let's move on to our next clip. It's Dr. McWilliams again.
Here's what I am putting together from what you've said so far. That growing up, all kinds of decisions were made for you by other people.
Right.
You had no say in it. You just had to cope. You had no opportunities to develop your own sense of agency, of having control over your own life. And when you hit your teenage years, you determined to live your own life with a vengeance, in a way that was self-destructive, but at least it was your self-destructiveness. You were in charge of it. And so I find myself not surprised that you let other people influence you a lot, because I think there was a disturbance of your sense of agency. And in a way, it's a repetition of, listen, everybody else knows where you should be.
Right.
You should leave the guy. Or
Right.
We're moving.
Right.
And the only way you could feel your own sense of agency in that situation was to precipitate exactly what the loss was that you were afraid of. It's like a kind of acting out.
Right. Right.
But at least you did it. I mean, in some ways, I think one of the consequences of your history is that you can feel your power mostly in opposition to someone else's agenda.
Yeah.
And when you're headed toward the finish line in whatever it is, and you start feeling that some other agenda is now controlling you, you may need to throw a monkey wrench into everything. That's how I'm putting these
That's
things
interesting.
together.
That's interesting. Yeah. That's. Yeah. I think that's. I think that's what it is, and I think, but. I don't know, because what am I opposing now? You know what?
Yeah,
You know?
well, the unconscious isn't so rational.
Well, now, okay.
We do find ourselves, and that's really what you came in for. That you keep enacting something that doesn't make sense, and you're saying to yourself now, why doesn't it make sense? But in a way, it made perfect sense in your family of origin. That really was the only way that you could feel like you were living your own life.
But why couldn't I have done that in a way that was more constructive than destructive?
Well, you would have needed some help from the adults in your life to give you a slowly developing sense of agency, including maybe things like saying to you, we do have to move, but let's figure out what would be best for you given that we have to make this move. I mean, I think your mother with 3 kids probably couldn't sit down with each one and do that.
Right. Right.
But some parents will very carefully do that. I know you're miserable about moving, but at least let's talk about how you want us to paint your room.
Right.
Whether you want to go to the public or the private school,
Right.
let's think about those things. I mean, that's how you help a kid get a sense of agency.
True.
Nancy, this is an extended interaction, and you seem to be attempting to do several things. Could you talk a little bit about that, and did you get what you were expecting?
I guess I got what I was expecting, which was she kind of took it in intellectually. And I'm struck by this is probably the most I talked in the whole tape. And it came out of my sense that if I'm developing a formulation about a person based on a kind of set of psychoanalytic ideas about the development of, in this case, a sense of agentic selfhood, I want to share that with the patient and see whether they are on board with the way I'm thinking about it, see whether that surprises them or whether it's something they've thought about or whether it's something they say is wrong. So it was a more intellectual part of the treatment, but I feel we owe it to people to give them some knowledge about where we're coming from. And that was what I was starting to put together. Chi-Chi was a diplomat's daughter. She moved a gazillion times in her formative years. She had no choice about it, and she had no responsiveness to her pain about it. And I think she minimizes that because to her, that was normal. That was just life. So I was trying to make it a little bit alien for her, to think about it as if she were looking at a child now with that history, as opposed to, well, of course, that's just the way it was. So I guess you could say I was trying to make something that she thought of as egosyntonic, ego-alien, to use the old language.
The rest of you have some thoughts about
I
this?
thought the way that Nancy conceptualized it really made sense. My technique would have been just more to draw it from her, or to perhaps even use the same kind of conceptualization, but ask it more in a question form. So, what do you think of this? Or, I have an idea, I'd like you to tell me whether you think I might be right about this or wrong about this. On the other hand, I would be more likely to take a current situation in which she's feeling out of control. For example, not being able to get herself to work on her writing, and to ask her, well, what is that? What are her thoughts about that? And what is the meaning to her? And we probably would get back to this idea that she may have a basic belief that operates some of the time. I don't think it operates most of the time, but that she's a little bit helpless, she's a little bit out of control. And we may have spent a little bit of time talking about where did that idea come from, so we can say, well, no wonder you have this idea about yourself. Can you see that, almost any kid in this kind of environment might grow up to believe this about herself? Okay, so now what are we going to do with it? And then the focus would have been on the present.
One thing that stood out for me was your facial expression, and this picking up from the previous commentary, because when you expressed the sense of lack of agency, you actually communicated a type of assertiveness with your face, which was the assertiveness that she didn't have. And you were sort of like her advocate, for you really deserve to have this kind of thing. And I was just really struck with, how much goes on at that nonverbal level.
Interesting, yes.
And throughout watching yours, I was amazed at how you were able to non-judgmentally put out some fairly strong interpretive comments as I saw them. And I too, agree with Judith that I would have tried to draw it more out. But I was struck how you're engaged in narrative reconstruction with her, talking about making it ego dystonic. Of getting her to see it in a new way. And my goal would be to get there at the end, but the process would be for it to come from her, and then at the end to be able to crystallize it in that form. But you were giving it to her, and in a masterful way such that she receives it, whereas I could imagine those statements being given in a way that would get some kind of resistance.
Well, I also think I should say, in the interests of honesty, that I think my worst quality as a therapist is the flip side of my best quality as a teacher. I find myself lapsing into roles of trying to teach someone. I think I do it empathically, but I think I keep it as a goal to do exactly what both of you are talking about, that it's better if it comes from the patient. And yet I can't stop myself sometimes. So.
Now, Judy operates from a model that's called cognitive therapy, but I noticed that both of you are really working pretty directly with cognitions as well. Can you speak to that?
Yeah, I think that's part of the psychoanalytic tradition I was trained in, impulses, affects, cognitions, behaviors, sensations, they were all talked about. And I think part of the difference between me and Judy, I would guess, but you can correct me, is I put more emphasis on how some of those cognitions are really pretty deeply unconscious. And I think the idea of distorted or irrational beliefs assumes more accessibility to consciousness.
I think you're right about that. And in cognitive therapy, we find that just by asking for the meaning of their thoughts, we're able to get down to the rock core bottom, these ideas that Chi-Chi might have: I'm helpless, I can't get myself to do things, I'm out of control. And that we can get to it quickly by asking for the meaning, and we don't have to assume that there are unconscious meanings that she's not able to come up with, for the most part.
And I see that, firstly, cognition is a very complex word, because really emotion is filled with cognition. It has attention, it has perception, and the word cognition has become a a catch-all that's become meaningless in my view. So that thoughts and beliefs are not explicitly the only cognition. So I use cognition all the time, especially attention and attentional allocation. Pay attention to your body is cognitive because you're paying attention. I prefer to talk about working with meaning and with narrative. That's what I think is the complexity of human nature, is that we're strongly meaning-creating beings. But there's a sort of different I do think things are far more automatic and not conscious, and then that there's a form of lived experience that is not in language, and that the brain talks through the body in an affective language, and that the goal is to put symbols to make meaning from that bodily experience. So it's a different view of cognition, but I work with meaning all the time.
Each of you have talked in different ways about, what you're trying to accomplish in a given session. And you've talked in different ways about what you want to accomplish by the end, what you want to register, store in memory. Could you talk a little bit about how you try to do that?
Well, I think I do it probably pretty directly. So the patient comes up with the idea, as Chi-Chi might, I can't get myself to start on my writing project. So then we look at the evidence that that's true or not true. It looks like it's pretty true because she hasn't been able to up till now. And then there's really a question of whether the focus needs to be on going deeper with that and really looking at this helpless idea, or whether to be more problem-solving oriented. But by the end of the session, we have a plan that I want to have in writing for her to be able to carry through.
I would see that when somebody comes in with a symptom or a problem, that they are not suffering from skill deficits in general. I mean, some people might, and I would make that kind of assessment, but that generally I'm looking for the underlying determinant. And I think that's sort of with the clarity and sureness and confidence with which the therapist can capture the kind of chronic underlying pain, that then we get to agree to work on that underlying pain that is leading to the symptom, or that the symptom is a manifestation of. Because I think the problem with working directly on the symptom, and with Chi-Chi, is she talked in the intake interview about all kinds of problems in her life, an anger problem, a drinking problem, a relational problem. And usually these problems go across situations, across experiences. And so I'm looking for the sort of core underlying determinants, and then get an alliance to work on that. And I think the difficulty with my session with Chi-Chi was, because it's all happening so quickly, and in a demonstration therapy, which is different to what you do in an actual therapy, we didn't necessarily get a clear collaboration on that she wants to work on or sees the relevance of working on this core shame from the mother and the abuse and so on. But in a normal therapy, I would be working towards getting at agreement on that as a goal. And the goal really is to work on the chronic underlying pain.
I think the main thing that I work on, at least in the early sessions, is trying to develop a sense of safety. Because I'm often stunned by how much patients withhold from us, how they may take 2 years to tell me that they're not having sex with their husband, for example. And I want to keep checking in. Are you feeling safe saying everything, showing me everything? So I will tend to check on that a lot. I think a lot of the therapeutic power of any given session is a patient's sense that I could be fully who I was, or I could approximate being more fully who I am, safely, with another person bearing witness to this. So that's where I would be coming from in a general way.
Right, and I just want to piggyback on that. I would say that's my goal as well. In the demonstrations, I'm demonstrating the more active aspect, but I think the relational safety is the sine qua non, because you can't really get to the deep emotion without that safe relationship.
In the contemporary language of attachment theory, you're creating a secure base
Yes.
And if the person has insecure attachment, you're trying to slowly help them to develop more secure attachment.
And in cognitive therapy, as in every psychotherapy, the therapeutic relationship is paramount. If you don't have a good, safe, sound, trusting, collaborative relationship with the patient, the patient's won't probably join with you, won't engage fully in treatment with you. I've not had a problem, though, with most patients in developing this sense of safety and trust. One of the things that I do at the end of every session, which I think is helpful in this way, is that I ask the patient, what did you think about the session? Was there anything that bothered you? Was there anything you thought I got wrong? If there were, would you be brave enough to tell me? And so I address a potential problem right away, and I do that at the end of every session until I really feel as if we
But I
are
think
fully
there is
engaged.
a different kind of relationship that you set up,
Yeah.
and it's much more distant. Well, I mean, that's not exactly the right word, but it's more of a rational type of relationship, which is more, you know, we're doing this and it's working together on something.
Pragmatic.
Pragmatic, as opposed to a face-to-face intimate relationship.
Let's see if we can
They're
see
different
that. You know,
styles, I
it might
think.
be apparent in the next clip we're going to watch, which will be our final clip with Dr. Beck. Let's go to it.
The way that you presented it before is certainly a reasonable way to present it, except that you come across as a little bit angry and critical of him. So just another way of approaching him might be to say, I'm really confused. Because it's obvious to me that you've wanted a kid, or you've had positive feelings about having a kid for a number of years, and I haven't wanted to. And I thought that I had made that really clear, but I'm confused as to what's in your mind and whether that's still something that you think is going to happen. And then, how do you think he would react if you said it that way?
I think he would probably say, what would he say? He would say, well, what are your reasons for that you think that you don't want to have a child? Or that you don't think you can have a
See,
child?
Mike, I'm a little confused because I feel like I've gone through all of the reasons before, and I feel like you think, gee, if I can't, Chi-Chi can't make a case for this, then we'll have a child.
Right,
And,
right.
and I have to tell you, just in my heart of hearts, I love you, Mike, and I want to stay with you, Mike, but I just don't think it's a good idea for us to have kids. And you're just not going to win me over.
Right.
And then what do you say to that?
What would he say? I don't know. He would probably say, he would probably say, well, let me hear all of the objections and I will provide a solution for each of those objections. That's his way.
Yeah.
If you say, I don't want something, I don't like something, his way is to say, well, give me all of your objections and I will come up with a solution for each one.
And out of role play, Chi-Chi, do you feel like you've already done that?
Yes.
And there's just no way he's going to...
No.
So then I think you have to say, Mike, just any amount of logic isn't going to change my mind on this. I'm really sorry. I mean, I wish I could go along with you. I can see that this is really important to you, and I like to make you happy, and I wish I could do this for you. But
that would be a good way to phrase it.
But I really can't.
Yeah, I think that would be a more constructive way to phrase it than what I have been doing, which is to, you're not listening to me. But
and what do you think he would say?
I think then he would probably hear it, and he would. I think he would hear that, and he would understand that to some level. I don't know what he would do after that. I don't know. Part of my frustration with it is that I think that he has been in long-term relationships in the past. He had 2 long-term relationships before me. My feeling is that people who want to have children do that, they know that, and they do that pretty early in their life. So why didn't that happen with those? Well, in fact, I know in one case, It was the woman who wanted to get married and have children, and
Yeah,
he didn't.
and he didn't.
So part of me wonders how much he really does want this.
Yeah.
Because I think people who do want children know it early and they plan their lives that way.
That may be, or for any reason, but in any case,
Yeah.
I'm not sure how relevant that is
Okay.
if this is something that's so strong inside of you.
Okay.
Now, are you fearful that he may want to break up with you?
I am.
And would you tell him that? Mike, I'm really afraid you're now going to want to break up with me.
Judy, can you comment on your work in this session?
So in this part of this session, she specifically asked for help with telling her boyfriend that she doesn't want to have a child. And she's approached this before. She's been frustrated. She feels as if he doesn't really hear her. He brings it up as if they haven't had the conversation before. So in this part of this session, I'm just doing a role play with her. Now, I guess the first thing I did was to ask her, in this next time you talk to him, what would you like to say to him? And she came across with something that was okay, but it was really kind of angry. And I thought, boy, if I were in Mike's shoes, I would really be taken aback by this. And if her goal is to have Mike understand her, perhaps she has to approach him in a different way. So then I said, is it okay if we do a role play and I model to her what she could say? And then was looking for what reaction might he have back so we could continue the role play.
Yeah. Comments you might have?
Again, I sort of was tuning in on you're staying at a very intellectual level with her, but at the very end, you got to the thing that was hitting me between the eyes in the clip, which was I just identifying with her. I thought she's terrified that if she really gets her point across, that this is a real firm no, he will leave her. And you did get to that by the end. But
And then we actually then talk about that for the next segment. And it's very interesting because what she comes up with is, if I lose Mike, I'll never have anybody else. Not because there's something wrong with me, but that there's something wrong with my judgment that I'll pick bad guys again like I did when I was in my 20s. So then that was a distortion we could really work with.
okay, and I would have gone to a very different direction. I would have gone to the conviction that she had internally that, like the other people in her life, they were going to disappear on her. And that, of course, is a possibility. If you tell a man who deeply wants children that you're not going to have children, that is something you'll have to face. And then I would want to communicate that if the worst happens, she could probably bear it. But I think I would go more into the affect about the fear. I think it's based on deep stuff from her childhood. She was separated from her father for months at a time as a kid.
On the other hand, she has approached this with him before, so it's not as if she's avoided this topic.
Well, yeah, but she hasn't approached it in a way that's gotten him the message absolutely clearly
No.
that I am saying a flat no here. And I think there's a reason for that. I think she's terrified to be that definitive.
It seems like you guys are already doing this, but how about some comments and questions about each other's work to each other right now in the program? What thoughts, comments, questions might you have?
I'm not sure. I mean, I have a statement which is, you know, and it's tying off this. I mean, I think I don't have the assumption that people sort of have a deficit and that you can coach them to do things better. You know, this is the basic assumption, and it's more like that there's some deep kind of affective process that's blocking them from doing these things. So that's always just a kind of difference. But I understand, I mean, if you can coach her and she approaches the boyfriend differently as a function of this session, and if you're there the next session to help, that eventually things in the world might change for her, and there'll be a kind of change because there's been an external loop change, you know, what happens in the world. I'm working in a different way, that internally there's an anxiety, a block, a sense of shame, and that as soon as anxiety rises, her behavior is no longer under her conscious, deliberate control. Her affect will take over. That somehow we've got to work on that, so that eventually she's able to talk to the boyfriend in this way. Those are the different assumptions, I think, that we're working with.
And in that area, I find myself often identifying with what Les says. I think I sign on to the psychoanalytic idea of how inherently conflicted we can be, how complicated we are, how sometimes just holding a paradox is more important than solving a problem. Some parts of life are paradoxes to be tolerated rather than problems to be solved. So I think that's a temperamental quality as much as a theoretical quality. I think I'm attracted to a theory that talks about our brokenness, our conflictedness, the depth of, my colleague Stan Messer wrote about, who's very respectful of cognitive behavioral approaches, wrote about them having a more comic vision, not in the sense of comedy, but in the sense of things are going to come out if you change your behavior. And the psychoanalytic people having a more tragic vision that life is really difficult, and we can be there to help each other bear it. So I think that is a temperamental difference, perhaps, between us.
And I think what's similar to us is that we all want to help people decrease their misery. By the end of treatment, we want them to be functioning better. We want them to be feeling better. And some of this has to do with, it all has to do with how do we get them there. And I think just cognitive therapy takes a much more direct approach until proven otherwise. So let's do the problem solving, let's teach you how to think more clearly, let's help you correct the distortions in your thinking, let's figure out what your goals are, let's figure out how to get you there. And doing that with many patients is enough, and then they feel better and they stay better. And with other patients, particularly ones with Axis II disorders, it's not enough, and we do have to plumb the psyche a little bit more. We do have to go more back into childhood.
Well, I think we've done a great job today in terms of talking about similarities and differences, and I hope our viewers have enjoyed everything that they've seen. They saw 3 great examples of psychotherapy. They watched this whole series from end to end. Thank you very much.
Thank you.
Thank you.